Welcome back. Medicaid is a government program that helps disabled and low-income adults, but it also helps kupuna who need more long-term care. In this week's Aging Well, Diane introduces us to a Honolulu specialist who helps the elderly through the process to apply.
My grandmother was just laying down and she was like on the floor in the bathroom and she couldn't get up.
That's when Matt Chun-Hori knew it was time to put his grandmother in a care home. But when he looked into the price,
our family couldn't support the kinds of costs that were coming from, a lot of the private facilities.
He tried applying for Medicaid himself, but it was so confusing, even he, an IT professional, had a hard time.
There's probably a resource online somewhere tucked away in some really obscure document, but it's actually a lot more difficult to find than I feel like it should be.
Enter Scott Gardner and company. They walked Chun-Hori through the process.
The Medicaid long-term care application is the most stringent application, and if we could explain it in a way, it's almost like an audit.
This is the 30-page Medicaid application. If the number of pages isn't daunting enough, Gardner says a very common mistake among many of the technical and complicated questions is, step one, tell us about yourself. He says a lot of people end up putting their names when it should be the person that they're applying for.
It's very technical, and if you just put down the one wrong thing, it could get denied.
For instance, most people think you have to be poor, but it's not that simple. The government looks at the last 5 years of your bank statements.
If mom was trying to unload her money purposely, to purposely qualify for Medicaid, that would be denied.
And yet, the care home doesn't want to see a completely broke applicant.
Before parents spend all their money down, you would really need to set some aside, and that's going to give them buying power or leverage to get into the facility that way and then convert over to Medicaid.
Gardner costs about $5,000, but long-term care costs $5,000 to $12,000 a month. For those on Medicaid,
the person agrees to give up their monthly income to the facility, except for $50 for haircut, and then the state or Medicaid will pick up the entire tab after that.
That is totally worth it because the service that they provided to us was way more valuable.
Chun-Hori's grandmother qualified, and he says the money was well spent to buy him peace of mind. Diane, KITV4 Island News.